it's CJ. Are you currently pregnant with twins? If so, you have definitely come to the right place. Today I'm going to let you know 8 of the possible pregnancy complications that can occur when you're making multiples, and I'll also let you know some things that you can do to help minimize risk to you and your babies. Number 1, intense pregnancy symptoms. And those symptoms can come on a lot earlier than if you were only carrying one baby. Because you have so many hormones, nausea and vomiting, heartburn, and with the extra weight of babies, a lot of pelvic pain, lower back pain. If the simple measures are not working, do not hesitate to talk to your OB provider about getting pregnancy-friendly medication to help manage those symptoms. Number 2, you are at increased risk for gestational diabetes because you have a lot of placental tissue. You will definitely want to do your glucose tolerance test between 24 and 28 weeks as instructed by your provider. And if you are diagnosed with gestational diabetes, keep a close eye on those blood sugars. Number 3, increased risk for hypertension or preeclampsia. Carrying more than one baby is actually one of the major risk factors for preeclampsia, so in all likelihood you will be instructed to take a low dose or a baby aspirin, 1 or 2 a day, starting between 12 and 28 weeks. Keep in mind, the earlier you start taking the medication, the more protected your babies are. Number 4, anemia. Your provider is probably going to keep a close eye on your lab work, and if you are diagnosed with anemia, they will probably give you an iron supplement. The best way to take iron pills is on an empty stomach with some vitamin C, either a tablet or some orange juice. In the meantime, eating a diet that's rich in iron can also be really helpful. That includes red meat, chicken, dark green vegetables, iron-fortified breads and cereals. Number 5, you are at increased risk for preterm delivery. 60% of twin pregnancies are delivered before 37 weeks. So you are probably going to want to make sure you have everything together well before 36 weeks. Number 6, your babies are at increased risk to have congenital abnormalities such as heart defects. So most likely you will be referred to a high-risk doctor in your second trimester for your anatomy scan. Number 7, fetal growth restriction. Twins often run smaller than single babies, so it's normal for you to start having growth scans every 4 weeks at 28 weeks. And if at any point either of your babies is showing signs of fetal growth restriction, you will be monitored a lot more closely until you deliver. And number 8, if your babies are sharing one placenta, you're at increased risk for a syndrome called twin-to-twin transfusion. That is when one baby is getting more blood flow than the other baby. If that happens, you will definitely be referred to a high-risk provider, and they will monitor you very closely until you deliver. So what questions do you have about your twin pregnancy? I hope you'll let me know in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button and/or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.